Welcome back, YouTube. Skippy02 here. Right here we're going to talk a little bit about basic trauma care treatment and medical, specifically supplies. I've been doing a series on EDC, and that involves medical, and this is just a little more in-depth as to what some of these products are that are most commonly utilized within your typical IFAC, Epic, this kind of thing. So getting right to it, I'll just start with what's in front of me. Trauma shears. A good set of trauma shears shouldn't cost you more than 10 bucks. These are specifically Madison Supply. They're pretty good for the money. One of the features I like about them is they have the built-in cord cutter as well as the serrated teeth. Not all of them have that. These happen to be all black. That's another thing I like. But anyway, good set of trauma shears. Some kits you'll find will actually include trauma shears. Generally speaking, those are not always necessarily high quality. But anyway, a decent set of shears, the kind that don't easily flex or bend, have good pivoting motion, solid hinge point. These happen to be riveted, and the rivet is nice and snug, but the motion is clean. Things to look out for. Basic patch, something to identify or indicate that the contents of whatever this is affixed to are medic related, kind of self-explanatory. Couple pairs of gloves. I prefer nitrile. Some people have latex allergies. That includes me. So nitrile gloves. I got two different sets. You may not be the only person using these gloves. You may have somebody helping you. In fact, you may not be using any of the supplies at all. It may be that somebody else or several somebodies are patching you up, as it were. So bear that in mind. A couple pairs of gloves, and again, I like the nitrile ones. Good tourniquet. This is a soft T, W. The W indicates wide. It's an extra ½ inch wider than your standard. This is what's called a flat fold. I prefer these. They're about the same money as regular cat tourniquet, or the cat 2, or even the regular soft T, but it's wider. And they use a aluminum windlass. Plastic ones are known for breaking, especially around their lock points. That's no good. You lose all your tension and you start bleeding out. Excellent tourniquet. I highly recommend these. Make sure your kit has a tourniquet regardless. Keep some hand sanitizer. Bunch of different uses. If, God forbid, you ever have to utilize any of this, odds are you're going to be bloody. You'll want to clean yourself up. And if you're taking the time and it's permissive, doubles as a sanitizer. We all know what these are. I'm not really going to go into that, but, you know, sometimes things happen. Well, it's a discreet but handy way to have that base covered. Couple types of tape, bunch of different uses. I like the elastic spongy tape of this. This is like your common sports wrap type tape. This is regular surgical tape, although it's a little thinner than I prefer, but it's convenient. So have you some good tapes. Duct tape always works well. This is selex. It's a hemostatic agent. Basically, this causes the blood to coagulate expeditiously. This is a large pack. This stuff is not cheap, but this would take care of a very, very serious wound, or multiple minor, I guess, if you want to look at it that way, wounds. But anyway, selex. There's other similar products on the market. Personally, I prefer selex. Speaking of other products, Clot is one of those competing manufacturers, I guess. This is their product, Combat Gauze. Basically, this is ultra compact and compressed folded gauze that has the coagulant agent Clot embedded into it. You would use this after putting this into a wound, cavity, channel, whatever. This will immediately start to cause the blood and so forth to coagulate, thus minimizing bleeding. You would then want to pack that wound. That's where this would come in. And the fact that it has the Clot added to it is kind of a secondary no-brainer. Anyway, all of that goes towards adding pressure towards the wound to help minimize bleeding. This is just common everyday sterile gauze. I buy it in bulk. It's much more affordable that way, and then I can't compress it down like this, but I can do this, and it doesn't take up that much space, especially if I'm putting it into a larger IFAC or Epic, something like that Condor tearaway. This is a roll of sterile gauze, partially compressed and rolled. Same thing. It's for, you know, stuffing into wounds, lacerations, and so forth. Moving along, I've got some iodine prep pads, some alcohol prep pads for minor nicks, wounds, things like that. For example, if you had a small laceration worthy of a couple stitches perhaps, you could take a prep pad or an iodine pad to semi-sterilize it and then wrap that off with a piece of gauze and then cover it in the tape of choice. Up here, these are chest seals. Basically, they're large occlusive dressings to close up large wounds. These are handy dandy. These are not the vented kind. But speaking of the vented kind, there's lots of companies that make these, and the vents tend to be unreliable on most of them. That's why I don't bother buying the vented kind. In a worst case scenario, if a tension pneumothorax was to begin producing itself, you could always pull this away, vent the chest cavity manually, and then reapply these. These are insanely sticky. Here you have an NPA, that's a nasopharyngeal airway. If your victim is unconscious, it's entirely possible they may be having breathing problems. This basically runs up through the nasal cavity and down into the airway and assures you a clear passageway for oxygen. If your person is not breathing, that needs to be addressed. This is an Izzy bandage, or Israeli bandage. This is specifically an emergency bandage from, I think this is NAR, I think is who provides this one. But anyway, it doesn't really matter. Basically, it's an Izzy bandage, Israeli bandage. These things have a dozen or more uses. They're so, I don't even know what to say about them. I mean, I'm not going to tear this open and go into all the details of all the things you can do with these, from splints and slings to pressure pads to partial tourniquets. I mean, these things, kind of a one-stop shop for a little bit of everything. Got a couple of applicator sticks. No real super duper high speed use there. They're just handy, and I've found them in the past to be useful for some simple things. These are ordinary tongue depressors. I like to keep a couple of these on hand. They make good splints for fingers and toes. Set the joint or digit straight. Break off a stick to length. Wrap it in tape. Therefore immobilizing it. Also, if you're in a situation where you may have a patient who is going into convulsions and seizures, tongue depressor comes in handy to prevent the swallowing of their tongue, and that's a whole nother medical situation. I'm not here to get into that. And then this is a little gadget that I make. It's a universal item holder. Basically, when you've got strips of molly, you can lace this into the molly, and you have these adjustable and securable bungee strings, shock cords, whatever. and you can then use these loops to hold, say, a tourniquet or a flashlight or a knife or chem light, whatever. But I normally will have one or two of these if the IFAC or whatever has Molly on it, just to add simple extra carrying potential. But anyway, this is a basic set of trauma care medical supplies. One thing that is arguably missing from my kit is a chest dart or a catheter. I am not certified or overly proficient or experienced in the use of those, so I do not choose to carry one of those. I am personally seeking to get training in that, because that is a damn sure handy item to have in the event of a tension pneumothorax, which unfortunately is very common with chest wounds. But again, that's a more involved conversation for another day. Anyway, what I would say is that the majority of this stuff makes up pretty much the absolute basics and must-haves. A few of these items are extra incidentals, bonuses, if you will, but the necessities are definitely here to treat and care for most major traumatic situations that you hopefully won't ever find yourself in, but you never know. But anyway, enough of all that. I thank y'all for tuning in and watching. As always, I'm open to conversation and dialogue, questions and everything else. As usual, put them down below. Be sure to like, share, and if you're not already subscribed, please do so. We've got more of these videos, and sky's the limit. You never know what else is coming from this old boy. But anyway, again, I thank y'all for taking your time and watching. Take care of yourselves, everybody. Take care of each other, and God bless.